You're standing in the produce aisle, comparing oranges when someone nearby coughs into a sleeve. You think flu, maybe COVID. Almost nobody thinks RSV. That blind spot made sense for years. RSV was the baby virus, the daycare virus, the bronchiolitis word new parents learned at 2 a.m. But viruses do not care about our categories. Pause. In older lungs, RSV can move from annoying sniffle to something that steals breath. In 2023, the FDA approved the first RSV vaccines for adults aged 60 and older, opening a prevention conversation doctors had never had before. At first, the message sounded cautious. If you were 60 or older, decide with your clinician whether RSV vaccination made sense. CDC's 2023 adult RSV guidance used shared clinical decision-making for adults 60 and older, not a broad everyone-get-it recommendation. That nuance confused people. Some heard casual choice. Others heard this probably does not matter unless you have grandkids. Then CDC looked at who was actually landing in hospitals. Thoughtful. The pattern was not subtle and it changed the recommendation. In 2024, CDC recommended one RSV vaccine dose for all adults 75 and older, and adults 60 to 74 at increased risk. That is the shift, less vague choice, more targeted guidance. Age matters, but risk factors matter just as much. RSV usually starts ordinary: runny nose, cough, fatigue, maybe wheezing. The problem is what ordinary can become in vulnerable airways. CDC describes RSV as a major cause of respiratory illness and hospitalization in older U.S. adults during fall and winter. One CDC RSV net analysis examined adults 60 and older hospitalized with laboratory-confirmed RSV across multiple U.S. surveillance sites. In that hospitalized group, 54.1% were 75 or older and 17.2% lived in long-term care facilities. Those are not abstract percentages. They point to grandparents, neighbors, and people whose bodies have less reserve when a respiratory virus hits. The same CDC analysis found 17.0% required ICU care, 4.8% required mechanical ventilation, and 4.7% died in hospital. So the adult RSV conversation is not about panic. It is about noticing which bodies face the highest downside from a seasonal virus. If you are 75 or older, the current CDC message is fairly direct. Consider RSV vaccination if you have not already received it. CDC says adults who previously received an RSV vaccine should not receive another dose under current guidance. That last part matters. This is not an annual RSV shot right now. The guidance is a single dose with duration questions still being studied. If you are 60 to 74, the question becomes more personal. Do you have conditions that raise your risk of severe RSV? CDC lists chronic heart or lung disease, immune compromise, frailty, and long-term care residence among factors that can increase severe RSV risk. Chronic lung disease can include COPD or asthma that limits breathing. Heart failure and coronary disease can also leave less room for a bad infection. The recommendation tries to aim protection where benefit is clearest, rather than sending the same message to every healthy 60-year-old marathon walker. CDC said the 2024 update was intended to maximize vaccination coverage among people most likely to benefit. Real-world data also helped. Scientists wanted to know whether adult RSV vaccines worked outside trials in messy everyday winter. CDC reviewed 4 observational studies and found RSV vaccine effectiveness against RSV-associated hospitalization among adults 60 and older ranged from 75 to 82%. A JAMA study of U.S. adults 60 and older also reported RSV vaccination was effective against RSV-associated hospitalization in real-world settings. Because those data are observational, they show association, not proof of causation. But the pattern aligns with vaccine trial expectations. This is where nuance earns its place. A healthy 61-year-old and an 82-year-old with heart failure do not carry the same RSV risk. The possible downsides matter too. CDC noted post-licensure monitoring had not ruled out a possible Guillain-Barré syndrome signal for protein subunit RSV vaccines. That does not mean RSV vaccination caused every case being studied. It means safety monitoring found a signal worth watching carefully. Public health recommendations balance expected benefit and possible harm. When risk from RSV is higher, the benefit side of that scale can grow. For most people, timing is simpler than eligibility. RSV usually rises in fall and winter, so late summer or early fall may be useful. CDC notes eligible adults may receive RSV vaccine at any time, but late summer or early fall is often optimal before the season. Think of this like preparing the fireplace before the cold arrives. You do not wait for smoke in the room to check the flu. If you also plan flu and COVID shots, bring them into one conversation. Your pharmacist or clinician can help with spacing and eligibility. CDC guidance allows RSV vaccination during the same visit as other adult vaccines, though side effects may vary by person. Practical step 1. Check whether you already received an adult RSV vaccine. Many people remember flu shots but forget newer vaccine names. If records are fuzzy, ask your clinic, pharmacy, or state immunization registry. Try not to guess when a database can answer. Practical step 2. List your risk factors before the appointment. Include lung disease, heart disease, immune problems, frailty, and long-term care residents. If you are 60 to 74 and healthy, your clinician may say RSV vaccination is not strongly recommended for you right now. That can feel strange. We are used to age cutoffs, but smarter prevention often means matching the tool to the person. If you care for an older parent, ask gently, not urgently. Have you talked about RSV lands better than a lecture? For long-term care residents, RSV risk can rise because age, frailty, close living, and chronic illness often overlap. CDC's hospitalized RSV net sample included 17.2% long-term care facility residents, underscoring why residents can matter in risk discussions. The adult RSV blind spot also affects testing. If an older adult gets a winter cough, RSV may not be the first suspect. Testing decisions belong with clinicians, but naming RSV can help families understand why a cold sometimes deserves closer attention. Do not use symptoms alone to decide severity. Shortness of breath, chest pain, confusion, dehydration, or blue lips should prompt urgent medical attention. For people with COPD, asthma, or heart failure, even a modest infection may push the body harder than expected. Prevention may help reduce that burden. The 2024 MMWR emphasized RSV vaccination for adults 60 to 74 with chronic medical conditions or other factors increasing severe disease risk. This is not about making one more health core. It is about adding RSV to the short list of winter risks worth planning around. One approach is to make a seasonal vaccine note in August, flu plan, COVID plan, RSV eligibility question. That one note can prevent the October scramble when schedules fill up and everyone seems to be coughing at once. If you are unsure, use this sentence. Given my age and health history, am I someone likely to benefit from RSV vaccination? That question respects nuance. It gives your clinician room to weigh your specific risk instead of forcing a yes or no script. The evidence is promising, but we still have open questions. Researchers are studying how long protection lasts and whether future repeat doses will be needed. CDC's current adult guidance says people who already received RSV vaccine should not receive another dose because revaccination recommendations have not been made. Hopefully, that may be reassuring if you dislike shots. It may be frustrating if you want a yearly routine. For now, the evidence points to patience. Health guidance changes when data improve. That is not flip-flopping. It is how careful science moves from broad uncertainty toward sharper decisions. The bigger lesson is not just RSV. It is that adult prevention is getting more personalized, especially for people with chronic conditions. If this episode helps you ask a better question at your next visit, consider liking or subscribing. It helps us keep evidence-based wellness practical. Before making changes, remember the limit studies guide decisions, but your medications, diagnoses, and history can change the best choice for you. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making changes to your health routine. So if you are 75 or older, RSV belongs on your vaccine checklist, especially if you have not received a dose. If you are 60 to 74, the key question is risk, lungs, heart, immune system, frailty, or where you live. And if you are younger, this still matters because you may be helping someone older navigate winter without unnecessary fear. The blind spot closes with one small conversation, not a dramatic overhaul. Just, should RSV be on my list this season? A better RSV plan can be simple. Know your age group, know your risk factors, and ask before the fall rush arrives. For caregivers, gather questions before the visit: age, diagnoses, living situation, past vaccination, and whether late summer timing makes sense. If someone had a serious reaction to a previous vaccine, consider bringing that history into the conversation before deciding anything. You are not trying to memorize CDC tables. You are trying to identify whether this recommendation fits a real person you love. That is better health, faster, fewer assumptions, clearer questions, and practical steps you can take before the next cough-filled winter.